So I was wondering about how you integrate genetic tests into your diagnostic workup. Like, are you doing that on all patients? Are you sequencing them? And then how does that change your management and treatment for these patients?
Yeah, specifically about Les. So Sharda also had this question specifically about Envisia and the testing that we do in clinic. How
Yeah.
does that affect how do you integrate it into your decision? And actually, could you explain what that is? What is Envisia and how does that work?
Yeah, so Envisia is a genomic classifier that sort of looks at a gene profile for any given patient's biopsy sample based off a transbronchial biopsy. So, relatively low invasive procedure. And it looks at the genetic profile to determine the sort of the likelihood that the patient has UIP based on these genetic profile. And so we tend to use it at our institution in the patients that have sort of an indeterminate UIP pattern on CT scan, um, and those a little more less certain cases, I think, is probably the best way to put it, to see if it can sort of push us over the edge, to increase that post-test probability after the Envisia that they have true UIP. So
Yeah.
we like to use it, and if you have indeterminate UIP and no real atypical features, but the patient wants to be a little more certain, those kind of things.
So Les, can I follow up on that? Now, the Envisia test is sent off of a bronchoscopic biopsy specimen, right? So this is typically a transbronchial biopsy.
Yeah, so yes, correct. So what we do at our institution when we do a Envisia bronch, we'll take quite a few transbronchial biopsy samples, and then half of them we'll send for Envisia. They grind them up and do what they do, and then the other half we send to standard surgical path for
Right.
you guys to see
So
what.
I'm guessing you will have some cases where pathology says UIP and Envisia also says UIP, and you're fairly certain that both are correct, or
Yeah,
vice versa, both say not UIP, and you're like, okay, both,
yeah,
right? But what do you do with the discrepant cases where Envisia says one thing and biopsy says the other? How do you handle those?
yeah. So certainly I will favor surgical path always. So I mean the sensitivity of Envisia is not great, and so you really got to be a little careful when you're interpreting that. And so if the pathology calls it, I mean that's sort of the gold standard, right? Now, often on a transbronch, because you guys are well aware, we don't get that answer. Then we tend to lead towards more invasive biopsy if we really feel like we need it at that
Yeah.
point.
And just for our audience, because the audience is mainly pathologists, and actually some of our colleagues must also be wondering, typically we get a transbronchial biopsy as one part and a cryobiopsy as a second part.
Yeah.
So I'm hoping that the Envisia is sent off the transbronch so that the cryobiopsy is left unmolested and we can look at that. I don't know if that's exactly how it works, Leslie. Which one is sent for Envisia?
Yeah, as far as I know, we do not send any of our cryos for. I think those are sort of too precious of samples to sort of grind them up and send them away.
Yes, yes.
So we just send the transbronchs.
Transbronch. So when we are making a UIP diagnosis, it's usually, not usually, it's almost always, it's off of the cryobiopsy, not of the just the regular transbronch.
Correct, correct.
Although both are done during the same procedure.
Yeah, and yes, they can be done during the same procedure, certainly. And I think we're doing that more often than not now, whereas before we were big cryo believers, then we were just doing transbronchs. But you're right, now we're doing transbronch for genomic classifier and cryobiopsy for the
The
pathology.
pathology. Matt, does that answer your question
It
or
does. Yeah. Can I just ask one follow-up to that?
yeah, yeah, please.
Do
Yeah.
you do any other testing like telomere testing or
Yeah,
any other genetic testing, especially
yeah.
if someone might worry about a familial or something?
Yeah, I'm glad you asked that because I think most of us don't really think of the Envisia as like true like genetic testing, quote unquote, right?
Right.
But we do send a fair amount of cases to medical genetics to sort of have that conversation. I mean, what we're learning is that there's probably more and more familial cases of pulmonary fibrosis. I mean, we know that that like 1 out of 5 patients with ILD has a family member with ILD. And so there's clearly some, you know, genetic and environmental factors that play. And so we are sending a fair amount of patients to medical genetics and sort of let them do the workup, whether it's telomere length testing or specific, mutational testing like TERT mutations, things like that. I will say that our transplant people here send any ILD case that they are working up for a lung transplant, they will get full genetic telomere length testing on them.
And how do those results like change the treatment pathways? Do those influence it, or is it mainly more for kind of giving information to patients and their families?
Yeah, so from an you have to sort of separate the ILD world from the transplant world. I think from an ILD world, we don't know yet what those implications are. There may be some medication choices related to like the Panther trial from the early 2010s that suggested maybe some of the short telomere patients did worse with some of the immunosuppression, but we don't really have a full understanding of that. However, in the transplant world, related to that, it affects their immunosuppression post transplant. That's why they're checking it. At least
So
that's my understanding.